So my name is Chris Verslype. I'm the Dean of the Faculty of Medicine now at KU Leuven for 1 year now. And I'm also a clinician and a clinical researcher in the field of pancreatic cancer. And I'm working in University Hospitals Leuven and the University of Leuven in Belgium. So my clinical and research focus has long been GI cancer, but in particular also pancreatic cancer. And so over the years, I've been privileged to care for patients facing this devastating disease, and I'm also involved in clinical trials also with the new compounds that are now being developed. So I was involved from the early days of Pancreatic Cancer Europe because I strongly believe that collaboration and advocacy are essential in this field. So it remains a deadly disease. Diagnosis is really made late. And my impression is that we need far more research efforts and especially financing in this domain. And the advantage is it brings together clinicians, researchers, patients, patient representatives, but especially policymakers. And it started in the past in the European Parliament, and I was very fascinated to be invited in the European Parliament, because for me it was the first time that it was invited there. So this made on me a big impression, and there was one of the members of Parliament that was really at that time very active. And for me, having also these people on board can make, in my opinion, can be a game changer. So the fact that it is a collective voice from all these stakeholders that really holds the potential to make a real impact. And so especially it's Europe, it's not United States, and we know we are looking a bit differently this time in the era of research towards some diseases, but I'm a strong believer of the European voice and the European effort in research on pancreatic cancer. So I've seen these patient representatives, professionals, that they unite around several themes like awareness, like access to new and innovative therapies, around research funding. And for me, this is in fact very attractive, but also when I look now to the website also, and I see that there are initiatives to support young researchers with grants, that there are leaflets developed on awareness, and maybe we have to do some additional effort to translate this a little bit to our local situation, but at least we have some ways of reaching the broader public, starting from a broad public voice. So for me, this has been to some extent already very rewarding also. It's a momentum that can be really truly inspiring. So it's all in terms of time, I think. So in terms of how late we often detect the disease, so this is for individual patients really a problem. And also the time, how long it really takes for a promising research finding to reach patients and clinical practice. So it's the effort of reducing the time in the individual patient and also for the group as a whole. So we urgently need earlier diagnosis, the better delineating of risk groups, picking up family histories and so on. I know there is a collaboration of PCE with rare digestive cancers, these organizations also, but I think this can be further explored. There is in fact a very good initiative also in Belgium regarding patients with risk for colon cancer, FAPA and so on, but this should really be extended to other families or patients at risk for pancreatic cancer. So, and also faster access to innovative treatments. So it makes no sense that the FDA is approving a certain class of drugs and that we have to wait in Europe for a longer time or because of some issues. So I hope really, with all the exciting developments that are now on the horizon for pancreatic cancer, and for me, pan-RAS inhibitors, it's a technical term, but this is for me the new generation of drugs. it's really reasonable to think that in 2 years' time, first or second line treatment of pancreatic cancer will not be chemotherapy anymore, but will be more personalized therapies like pan-RAS inhibitors. I'm very confident with that. And on the other hand, we have this new generation of anti-tumor vaccines that are being explored, that are more individualized and made following pancreatic cancer surgery. And the first results I have seen already are very clear that we can really postpone the recurrence for a very long time. So it's for the first time now, and I went to the ESMO meeting a few days ago, and there was in fact some enthusiasm about pancreatic cancer treatment, and this is an enthusiasm that I've not felt in all the years that I have been in practice. So a reason to more that we should be able to lobby and to make sure that all these treatments and developments reach also the European population as a whole much earlier on than in the past. So I believe that by working together, collaborating and advocating, that we really can make sure that pancreatic cancer receives all the attention and funding that it deserves. Yeah. So to all the patients and families, please know that you are not alone in this fight. I don't like the wording of fighting and war in these times when it relates even to cancer, but they are not alone in this quest for a long and a long life, and especially without disease, or if the disease is there, that we can keep it silent and that it does not interfere with quality of life. So there is a really committed community of clinicians, that's important to know, of researchers, and also political advocates working tirelessly for better outcomes. Patients always look to politics as a category of people and structures that may not be helpful at all, but they really should have trust in the European system. For me, the only basis of good financial initiatives and of maintaining the research interest at a high level should come from the European community, because when the budget is becoming a difficulty and financing is becoming a difficulty in individual countries, it's only a European initiative where they put a certain standard of percentage of research that can really make the difference. I'm a strong believer in that push from Europe in a positive way, and so that's really the message I want to convey to the patients. We have molecular insights in pancreatic cancer, potential new therapies, personalized medicine, but we should all work together of bringing this very early on to the individual patients.